Hello and welcome to the Mental Health Book Club podcast with your hosts Sydney Timmins and Becky Lawrence. We would like to take this opportunity to let you know that we will be covering a diverse range of mental health topics that may be distressing to some listeners. You can find a full list of the topics being covered in each episode in the show notes. Please check the show notes before listening to any of our episodes. Welcome to the Mental Health Book Club podcast with your host Sydney Timmins. Today you've just got me because this is going to be slightly different to our previous episodes where I'm going to focus purely on a mental health issue. And in this case we're going to look at anxiety, specifically generalised anxiety disorder and panic attacks. The idea behind this episode is to offer people with additional information about the mental health issues that we discuss in relation to the books that we read. And so this one is supporting the Anxiety Girl podcast, which was released last week. So let's start off by examining what anxiety actually is. So anxiety is the word that is used to describe feelings of unease, worry and fear. It incorporates both emotions and the physical sensations that we might experience when we're worried or nervous about something. And this is actually a normal response to certain situations that people may find themselves in. And although people will find that the feeling of anxiety is unpleasant, it is related to a normal biological process which is often referred to as the fight or flight response. And this usually occurs when people feel threatened. And so when you feel threatened, the body begins to release hormones which include adrenaline and cortisol. And this helps the body to become prepared to take the necessary action to the danger that we're experiencing. So we either fight it or we run away from it. And these hormones make you feel more alert so that you can act faster and make your heart beat faster to carry blood quickly to where it's needed the most, facilitating what your next actions are going to be. So when your body is feeling danger, you have this release of all these hormones, and once the danger has passed, your body then releases different hormones that will help your body to relax and your muscles to relax. And so these tend to cause you to shake. So often after people find themselves going through the fight or flight response, they then get shaky. This is something that we don't have any control over. It is one of those things that in modern society, because we don't face situations where we need to physically fight or flee from danger, it still occurs, but in situations that we then find anxious and we feel threatened. And some examples of those situations include sitting exams, going into hospital, attending an interview, starting a new job, moving away from home, going away to study, having a baby, being diagnosed with an illness such as multiple sclerosis, deciding to get married, deciding to get divorced, buying a house. All of those are all very stressful situations that you may find that you get anxious whilst those are occurring. And it's understandable to have worries about how you will perform in certain situations or what the outcome will be. And that is okay for brief periods of time. And in those brief periods of times, you might find it difficult to sleep, to eat, and to concentrate. And after a short while, when the situation has passed, those feelings of worry tend to stop. Because anxiety is a normal body sensation, it is often difficult to identify when your anxiety is becoming an issue for you. And because anxiety is a normal body sensation, sometimes we find it very hard and difficult to identify when the anxiety has become an issue for us. And so, for example, if you find that you're worrying all the time, perhaps about things that are a regular part of everyday life, or about things that aren't likely to happen, or even worry about worrying, that's when it's starting to become an issue. You also may find that you are regularly experiencing unpleasant physical and psychological effects of your anxiety, or even panic. And depending on the kind of problems that you're experiencing, you might be given a diagnosis of a specific anxiety disorder. So when anxiety becomes more a mental health issue and is diagnosed as an anxiety disorder, your feelings are more noticeable and difficult to live with. They can make you feel as though things are far worse than what they actually are, and this can lead to you worrying all or most of the time and can affect your day-to-day life. So that's when anxiety has moved from the normal sensations and the body processes that we should be used to something that is much more serious. And these symptoms of anxiety include the feelings of dread, panic or impending doom, feeling on edge or irritable. You may feel heightened alertness. You may find it difficult to sleep. You might feel like the world is speeding up or slowing down. You may feel that others around you can see that you are anxious and are looking at you. You will feel that your mind is always busy with lots of thoughts. You may find that you are dwelling on negative experiences, so ruminating. You may find that you have changes in appetite, so you may be eating more or eating less. You may be feeling numb. You may find it difficult concentrating. And you also might have something called depersonalisation or disassociation. So this is where you feel disconnected from your body and a detachment from yourself. And you may feel that you want to escape from the situation that you find yourself in. There are also physical symptoms that are associated with anxiety. And these include things such as sweating, nausea, heavy and fast breathing, hot flushes or blushing, dry mouth, tense muscles and headaches, shaking, hair loss, pins and needles, stomach churning sensation, a fast heartbeat. You may experience panic attacks, you may feel dizzy and faint, and you may find that you start to suffer with irritable bowel syndrome, stomach aches, and other sickness. The problem is we don't actually really know why some people experience anxiety as a mental health issue and others don't. However, we do know that if you tend to worry more than other people, it could just be something that is a part of your personality. Sometimes you might feel that the anxiety has no obvious cause. However, there are a few things that have been attributed to the cause of anxiety. So your past or childhood experiences may have a role to play in your current feelings of anxiety. So if you've experienced a distressing situation in the past, you may feel more anxious about similar situations again now. It could also be something that you've learned from your parents or your primary caregiver, because they may have felt that the world was a hostile or dangerous place, and it is something that you have then picked up and have learnt to feel the same way about the world around you. Your everyday habits may have also caused some of your anxiety or contributes to your anxiety. So, for example, if you're feeling exhaustion or stress, you have long working hours, there are pressures at home or at work, or if you're studying on your course, there could be housing problems or money problems. All of those lifestyle factors will have an effect upon your feelings of anxiety. Your diet can also play a role in how you are feeling and your mood. So, for example, certain foods such as caffeine and eating lots of sugar and generally having a poor diet can increase and trigger your symptoms of anxiety. Your physical and mental health will contribute to your feelings of anxiety. So, for example, if you have a long-term physical health condition like chronic pain, this may make you more vulnerable to experiencing any mental health problems such as the anxiety and depression. Also, if you already have a pre-existing mental health issue such as depression, this can also make you more vulnerable to experiencing anxiety. Certain drugs and medications can also impact anxiety. So, for example, if you're taking prescription medication or street drugs, which include alcohol, you might find that you can have an impact upon your mental health. So, for example, you might experience anxiety as a side effect of certain medications for mental health problems, certain medication for other health problems such as steroids or some anti-malaria medication, and also street drugs and alcohol can all impact your feelings of anxiety. There is also research that shows that genetics may have a role to play with your feelings of anxiety. So you may just be that you have inherited a genetic tendency to be more anxious than others. There are several different types of anxiety disorders that a person can be diagnosed with. I'm going to focus today on generalised anxiety disorder and panic attacks. However, there is a list of other disorders that you can be diagnosed with. So those include agoraphobia, which is an anxiety disorder where you have an intense fear of certain situations, such as leaving a house. Body dysmorphic disorder, or BDD, where people worry a lot about how they look or about a particular part of their body. And although other people may not notice or see it the same way, it can cause distress. So, for example, someone might have issue with the way that their nose looks. People may think that they have an odd body shape compared to other people, or that a scar makes them look unattractive. There's also hair pulling or trichotillomania, where it's a condition where people feel the urge to pull out their hair. Hair pulling can occur from the scalp or other places such as arms, eyelashes, legs or pubic areas, and people find it difficult to stop doing this. There's also obsessive compulsive disorder or OCD, which is an unwelcome obsession or thought or image that repeatedly enters a person's mind and is largely out of their control. They find it difficult to ignore, and people may not want these thoughts, and they can be disturbing and make people feel distressed and anxious. And so a compulsion occurs, and that people think about or do something repeatedly to relieve the anxiety that they feel from their obsessive thoughts. People might believe that harm might come to themselves or someone close to them if they don't do certain things, and people may realise that their thinking and behaviour is not logical but still find it very difficult to stop. So I guess the most common form is, for example, light switches or repeatedly locking and unlocking a door or checking things, and it can become quite debilitating. There's also post-traumatic stress disorder, PTSD. People can develop post-traumatic stress disorder as a result of experiencing a traumatic or frightening event. So most people will find that people that have gone into combat suffer with PTSD. I'm not saying that everyone that's gone into combat will suffer from PTSD, but that is one potential trigger for this anxiety disorder, and it can develop shortly after the event or months or years later. Skin picking, where people will repeatedly pick at their skin, and this can cause damage to the skin, which includes bleeding, bruising, and sometimes permanent marks. And people will usually pick the skin on the face, but might also pick other areas of the body, and people will find it difficult to stop doing it. There's also social anxiety disorder, also known as social phobia, where people have an intense fear or dread of social or performance situations, such as speaking in public groups, meeting new people or strangers, going out on dates, and eating and drinking in front of people. Toilet anxiety, where there is a fear of using toilets in either your own home, someone else's home, or in public spaces, and this can lead to difficulty and embarrassment when needing to use the bathroom. There's also anxiety where the cause is unknown, and this is where difficult events such as being bullied at school or seeing something traumatic can start some anxiety disorder, where brain chemicals and your environment can also cause anxiety. So this leads me on to generalised anxiety disorder. With generalised anxiety disorder, people feel anxious a lot of the time, and people may feel that they're out of control. People might feel on edge and alert to their surroundings constantly, and it also affects your day-to-day life and can become very debilitating. It can affect people's ability to work, to travel, or even leave the house, and people may get tired easily or have trouble sleeping or concentrating. There are several physical symptoms with generalised anxiety disorder, which include muscle tension, headaches, sweating, nausea, churning of the stomach, and the fear of fainting. Panic disorder and panic attacks in some ways are two separate things. Panic attacks can occur with any of the anxiety disorders listed. Panic disorder is often diagnosed when people are suffering from regular panic attacks, when there is no particular trigger. So a panic attack makes a person feel anxious and frightened. It can happen very suddenly and it can feel extremely intense, and it has a range of physical symptoms that include this overwhelming sense of dread, chest pain, and a sensation that you're having a heart attack and your heart is beating irregularly. You might feel that you are going to die. You will be sweating, there will be a hot flush, or you'll have chills and shivering. You will feel that you have a dry mouth, that there is shortness of breath, or that you're feeling like you're having issues with choking. You may feel nauseous. You may have pins and needles or a tingling sensation in your fingers. You may feel the urge to go to the toilet. You have ringing in your ears and a churning stomach. So when someone is experiencing a panic attack, it is very common that people have this sense of detachment from who they really are, and this is known as the depersonalisation, and it's a thought that this may be the mind's way of dealing with the intense sensations associated with a panic attack, because it is extremely intense. For some people, there are often certain situations that can cause panic attacks. So for example, if someone has a fear of small spaces and they go onto a plane, or they are going to have an MRI, that may result in a panic attack. However, there are also times when the panic attack occurs and they're not really sure what the trigger has been. The problem with the latter is that because you don't know when your panic attack is going to occur and you don't necessarily know that there is a particular trigger, that you then worry that you may have another panic attack. And so that worry can then cause panic attacks. And during a panic attack, you might feel very afraid that you're losing control, that you're going to faint, that you're having a heart attack, or that you're going to die. With panic attacks, it is often different for different people. So everyone is an individual when they experience anxiety and panic attacks. And there may be people out there that have a good understanding about situations or places they are likely to be triggered. But you might also find that the panic attack will come without warning and will happen at random. Panic attacks can also happen at night, which I didn't realise until I did this research. And this can happen whilst you are completely asleep. However, your brain is still very alert due to your anxiety, and it interprets small changes in your body as a sign of danger. An experience of panic attack during the night can be particularly frightening, as you may feel confused about what's happening and are helpless to do anything to spot it coming. To be honest, learning about panic attacks, I don't think I would ever want one, but I think it would be even more distressing to experience one at night when you have no idea what is happening. Panic attacks often last between 5 and 20 minutes, and they can come on very quickly, and symptoms usually peak about 10 minutes into the panic attack. Sometimes people might experience symptoms of a panic attack which lasts for up to an hour, but this is probably because the person is experiencing one attack after another, or that their high-level anxiety is activated after the initial panic attack, so you don't necessarily feel more relaxed once the panic attack is finished. The frequency of panic attacks, again, is very individual to the person that they're affecting, and so it's different from person to person. You might have one panic attack and then never experience another one again, or you may have several attacks in 1 month or even several times a week. So it really just depends upon the individual. There are many ways that you can try and manage your anxiety, and it is common to start thinking about what is actually causing your anxiety to trigger in the first place, identifying what your fears are, and then taking action about those can initially make you feel more anxious, because you're starting to try and identify what the problem is. But it's important to do this stage because then you can actually identify where it is that you can try and break this cycle of fear and insecurity and stop the anxiety before it really gets going. So if you are someone who suffers from anxiety and panic attacks, there are certain things that you can do to try and give yourself some coping mechanisms. So, for example, you can talk to someone that you trust. And so just by sharing with someone your anxieties can just help to relieve the worries that are in your head. You also might find that this person that you're talking to may have also encountered anxiety during their lifetime. And so they may be able to give you some tips and advice about how to handle the anxiety that you are feeling at this time. You may also find that just having someone that listens to you and cares for you and shows that they want to try, and sometimes all you really need is that knowing that there's someone there to listen to you and show that they care about you to help you with your own anxieties. The other thing that you can try is breathing exercises, and to be honest, when I initially read about breathing exercises and before trying it with my anxiety, I dismissed it. I thought it wasn't going to work. However, it actually does help just to ground you when you are getting to the point where your brain is running away with itself. And so just literally taking the time to breathe can help you feel calmer and reduce your anxiety. So what you need to do is take time to inhale, and it's the simplest thing. It's always with you. So just literally take long, deep breaths. Gently breathe in through your nose and out through your mouth, keeping the pace slow and regular. Slowly tense, then relax all the muscles in your body, starting at your toes and working up to your head. And afterwards, just take some time to be still and focus on how your body feels. And although it sounds like this is something that is too good to be true, I find that this does help you to minimise your anxiety. Also, another thing to help with your anxiety is to try shifting your focus away from the things that you're thinking about. So trying and distract yourself from the anxiety that you're feeling. So for example, I like to read, I like to do craft activities, I like to colour. There's a multitude of things that you can do to try and help shift your focus away from the things that you are feeling to something completely different. Some people may find that noticing the details around them and making their focus on what they see and smell and the sounds around them can help them. So that's kind of a mindfulness exercise. Others find that fiddle toys or puzzles or stress balls or something that keeps their hands busy can help keep their minds busy. And that can all help with dealing with anxiety. I also find listening to music can help. I either go for something that is really peaceful or something that is quite upbeat and something that I really enjoy, and all of that can make me feel calmer. You can also try reassuring yourself, so you may find it helpful to tell yourself that the symptoms that you're feeling now are caused by your anxiety and they're not going to be there forever and they're not dangerous and it will pass. And this can make you feel calmer and less fearful of any future panic attacks. You can also try physical exercise, and you may find that the physical exercise can help you manage your anxiety and panic attacks. You can also try physical exercise such as walking or running or other activities that can help you to manage your anxiety and panic attacks. If you're not able to do physical activities outdoors because you have limited mobility, for example, think about other activities that you could do indoors, such as exercising individual parts of your body. You may find that having one of those little step things that you can sit on the sofa and use may be something that can keep you active. It's also suggested that keeping a diary can help you deal with your anxiety, so keeping a note of what happens each time you get anxious or have a panic attack can help you to spot patterns, and from those patterns you can identify triggers and what experiences are triggering for you, so you can think about how to deal with those situations in the future. So kind of a way to reduce your anxiety is about getting hit with anxiety without knowing what the cause is. And you could also try keeping a note of times when you're able to manage your anxiety successfully, because it's not always about dwelling on what causes it, but also the fact that you can actually deal with your own anxieties. Also, ensure that you eat a healthy diet, so trying to avoid stimulants such as coffee, cigarettes, and alcohol, and just generally getting a healthy diet, making sure that you're having your 5 fruit and vegetables a day. All of those kind of things can help to reduce your anxieties. There's also a multitude of complementary therapies that you can try, and those include things such as yoga, meditation, aromatherapy, massage, reflexology. I like to have herbal teas. The idea is to try anything and everything to see how it can help, and if it can help your anxiety, just give it a go. You might also find that these methods can help you to relax and sleep better and manage the symptoms of anxiety and panic attacks. You also may find that chemists and other health shops stock different herbal remedies that can be used and will have a plethora of advice for people who are suffering with anxiety. You may also want to research into support groups, such as what we read about in Anxiety Girl. There are plenty of support groups out there that can give you the opportunity to share common experiences and different ways of coping, and listen to the stories of others who are facing similar challenges to you. And this can be a comfort to show that you are not alone in your struggle with anxiety. I shall ensure that I put some links to the anxiety support groups on our website for you. There are several different treatment options that you can consider for those that are experiencing anxiety. So, for example, there is something called cognitive behaviour therapy, or CBT, and that helps people to understand the links between their thoughts, feelings and behaviours. And it can help you to find ways to overcome your anxiety by challenging those negative thoughts and beliefs that are triggering your anxiety in the first place. There is also exposure and response prevention, or ERP, and this is most effective for a range of anxiety disorders, particularly OCD, or obsessive compulsive disorder. The therapist will encourage you to experience your obsessive thoughts without giving in to the compulsive behaviour, and they will gradually build up the difficulty of each of those tasks. There are also selective serotonin reuptake inhibitors, or SSRIs, so I confess I take an SSRI, and these are used to treat anxiety disorders including generalised anxiety disorder, panic disorders and obsessive compulsive disorders. There are also benzodiazepines. However, doctors will only prescribe these if your anxiety is extreme or if you are in crisis, and this is because they are addictive and they may become less effective over time. There are also beta blockers, and these can help with the physical signs of anxiety, and they can help to lower a fast heartbeat, shaking or blushing. And there's also the complementary therapies that we've discussed before. So if you were to go to the NHS for treatment for anxiety, there is a set protocol that health professionals follow, and so it is a stepped process, and this is governed by NICE, which stands for the National Institute for Health and Care Excellence, and provides national guidance and advice to improve health and social care. Once the health professional has identified that you have generalised anxiety disorder and panic disorder, the first steps that they will take is to educate the person with the anxiety about the anxiety and provide them with the NICE guidelines that this information has been taken from, and to monitor that individual, as less severe symptoms can be resolved by this intervention alone. However, if there's no improvement with the anxiety that the person is suffering, then they will move on to step 2. So in step 2, what they will provide is individual non-facilitated self-help, which is basically a variety of different materials that can be used by the individual to help them with their anxiety. So that includes written or electronic materials that are suitable for that individual's reading age. It is also to be based on treatment principles of cognitive behaviour therapy. It gives instructions for the person to work systematically through materials over a period of at least 6 weeks. And it can involve minimal therapist contact. For example, an occasional short telephone call, no more than 5 minutes, can be beneficial. The individual can be offered guided self-help, and that is supported by a trained practitioner who then facilitates the self-help programme and allows the individual to review their progress and identify whether outcomes are being achieved. And usually this consists of 5 to 7 weekly or fortnightly face-to-face or telephone sessions lasting about 20 to 30 minutes. The other thing that they offer at step 2 is psycho-educational groups, and again based on CBT principles, they have an interactive design and encourage observational learning, and this includes presentations and self-help manuals, and it's also again conducted by trained practitioners. If all of that fails, then we move on to step 3, and for people with generalised anxiety disorder and marked functional impairment, or those whose symptoms have not responded adequately in step 2, then the person is offered individual high-intensity psychological intervention, such as CBT or applied relaxation. And so for CBT, it is usually 12 to 15 weekly sessions. It may be less than that if the person seems to recover sooner, and it may be more than that if it is identified that that is needed, and those last about 1 hour each. The applied relaxation usually consists of 12 to 15 weekly sessions, again similar to the CBT, fewer if the person recovers sooner or more if it is clinically required, and those again last about 1 hour. The individual will then also be offered drug treatment, so that is SSRIs like sertraline, which is the one that I happen to take, and if that is ineffective, then the health professional will offer alternative medication, an alternative SSRI or selective serotonin reuptake inhibitor, or a SSNI, which is a serotonin noradrenaline reuptake inhibitor. If those aren't tolerated well by the individual, then they can offer something called pregabalin. However, pregabalin has quite a lot of side effects that are not necessarily tolerated well by those taking the drug. With all of these interventions, it is important that your health professional talks you through all of the information, all of the relevant information, because you may have concerns about what it is to take a medication for your generalised anxiety. So therefore, make sure that your health professional explains all of the details about the potential treatment options for you and get them to properly explain so that you understand what it is that is going to happen for you. This is also stipulated in step 3 that the health professional should talk through the treatment options with the individual suffering from the anxiety disorder. Don't ever be ashamed to ask additional questions if you don't understand the treatments being offered to you. Make sure that your health professional explains everything clearly so that you can fully understand the treatment options that are being offered for you. If the individual with generalised anxiety has severe anxiety and with that marked functional impairment and significant comorbidities, so that's things such as substance misuse, personality disorders or complex physical health problems, or even shows signs of self-neglect, and that they haven't had an adequate response to any of the step 3 interventions, then we move on to step 4. So for example, in my situation when I presented with generalised anxiety, I would potentially be put into this category because of the issues with my own personality disorder. So the individual moves on to step 4 when the complex treatment for generalised anxiety disorder and there is very marked functional impairment and high risk of self-harm. It means that you need a more in-depth intervention from health professionals. So people with generalised anxiety disorder who have not been offered or have refused the interventions in steps 1 to 3 need to be re-educated again about the potential benefits of those interventions. So if they've said, no, I don't want drugs, no, I don't want any interventions, I don't want CBT, I don't want a group therapy or any of that, then just the health professional needs to just go back through the treatment options again with the individual. At this point, it's recommended that the health professional considers offering combinations of psychological and drug treatments, so a combination of antidepressants, an augmentation of antidepressants with other drugs, but then this may not necessarily be the right treatment approach for the individual, so this is all done on an individual basis. And when someone is being offered a combination of treatments, this should only really be undertaken by practitioners with expertise in the psychological and drug treatment of complex anxiety disorders, and always after full discussion with the individual who is suffering from the anxiety disorder. I thought it would be nice just to add a quick note here that for me, when I presented with general anxiety disorder, all I was offered was some talk therapy on the telephone, and this wasn't suitable enough for the level of anxiety I was feeling, so I actually went private and got myself a therapist that specialised in borderline personality disorder. So for individuals that present with generalised anxiety disorder in combination with panic attacks, it's a similar process. However, there's an additional step at the end of the process. So step 1 is assessment and diagnosis of the person having panic attacks. The person is then offered treatment in primary care, similar to that of what was offered for someone with just anxiety. However, it is quicker for them to offer treatments on the NHS with trained professionals, so that includes psychological therapy, medication, also give information about self-help, and whatever the individual chooses to be their treatment option, that should be available promptly. However, this may not necessarily be the case for some individuals. So they should be offered cognitive behaviour therapy, and this is for approximately 7 to 14 hours in total, and it should be offered for most people to be in either a weekly session for 1 to 2 hours, and it should be completed within a maximum of 4 months of commencement. You can have briefer CBT, but this should be supplemented with appropriate focused information and tasks in between. An individual should then also be offered additional information that has a focus on CBT principles. Again, the individuals can be provided with information about support groups, similar to that what we saw in generalised anxiety disorder. Step 3 is where the person is reviewed and then also offered alternative therapy or medication if appropriate. At step 4, we move on. It's again further review of the individual who is suffering from panic attacks with generalised anxiety disorder. And if 2 of those interventions that have been previously given to the individual haven't worked, then a referral to a special mental health service should be offered. And step 5 is the care in specialist mental health services, where the team will conduct thorough holistic reassessment of the individual, environment, social circumstances, and then additional treatment needs to be provided for comorbidity conditions, CBT if not offered previously, also the addition of something called structured problem solving, a full exploration of pharmacotherapy, so that is trying different drugs to see what will help them with their panic attacks, additional day support to relieve carers and family members, and then a referral for advice, assessment and management at tertiary centres. And again, all of this is under follow-up for individuals with panic disorders. So if you know someone who is suffering from an anxiety disorder, there are several things that you can do to help. And so the first and the most important thing that I can stress is that you empathise with the individual that you are trying to help. And you can do this by thinking about what it is like for you when you feel anxious. What do you need to try and get yourself away from that anxiety? And is that a possible strategy that you could employ with the person that you are trying to help, for example? Even if your friend and family member's situation is completely different from any situation that you have ever suffered from, just having that understanding in the first place can help them. When someone is feeling anxious, just be kind to them. Try not to be judgmental, so don't judge why they're feeling the way that they're feeling, and just give them some time. Allow them to let the anxiety pass, and just let them know that you're there and that you care. Also, try not to put any pressure on them. So, for example, when you are in a situation where you're trying to help someone that you like and that you love, try not to push them to face their fear. They might not just be ready to face that just yet. Give them time and allow them to identify what steps can be taken to help them to get to where they want to be. You need to stay calm and just listen to the person and listen to their wishes, offer support, and only do what they feel comfortable with. If you just don't know what to do to help the person that is suffering with anxiety, one of the other things that you can do is just ask them what you can do to help. Don't be surprised if at the time when they are feeling anxious they don't know what they need. Just be there to support them, and eventually they'll be able to give you guidance as to what they need in that situation. As the old adage goes, knowledge is power. So again, if you're looking after someone or you are friends with someone who is suffering from anxiety disorders, take some time to learn about anxiety disorders. I mean, just listening to this podcast will help you in that regard. If they haven't already, encourage them to get help. Maybe go onto the internet and locate self-help groups and support groups and additional information that could help them. I will put information about where to get additional help and support on our website at thementalhealthbookclub.com. And because it can be very stressful for you to support someone who is struggling with anxiety, always make sure that you look after yourself as well. You also need to look after your own well-being, and you may find that some of the breathing techniques and mindfulness techniques that you can read up on will be beneficial to yourself as well. Also continue to do activities that you enjoy, because if you stop doing those, then it will be more difficult to deal with the other person's anxiety, and you may even start to feel anxious yourself. And so this episode has been a whistle-stop tour of general anxiety disorder with panic attacks. And if you need any additional information, please check our website at thementalhealthbookclub.com. Thank you so much for listening. And we will be back next week with Becky reviewing our next book, which is Dandelion Angel by C.B. Calico. Thanks for listening to this episode of the Mental Health Book Club podcast. If you feel that you need additional support with your mental health, please call the Samaritans on 116 123, which is a 24-hour helpline. And if you need additional information about mental health issues, please visit Mind at mind.org.uk. For our next episode, I will be doing a deep dive on general anxiety disorder. For those of you wishing to read along with us, the next book will be Dandelion Angel by C.B. Calico, which you can find more details at our website, which is mentalhealthbookclub.com. We would really love to hear what you think about this podcast. Please get in touch with us at our Facebook page, which is the Mental Health Book Club, or at our Twitter, which is at MHBC_podcast. And if you like the podcast, please share it with your family and friends, and leave us a 5-star rating on iTunes or wherever you get your podcasts.